Since the COVID-19 pandemic began earlier this year, doctors in South Carolina and across the country say they've noticed a decrease in the number of children getting vaccinated. Officials with DHEC say it's in part because of health concerns and people not wanting to physically go into a doctor's office. But medical experts in South Carolina are warning parents to make sure their children are vaccinated, especially as they head back to the classroom. Matt Koufax talked with doctors today about this trend and is live tonight outside Parkside Pediatrics in Simpsonville.
Yeah, Cody, so doctors, nurses, everybody here at Parkside Pediatrics in Simpsonville tells me that their doors are open for those well child patients who wish to get vaccinated, and they say it's more important now than ever before, especially for diseases like measles, whooping cough. Measles, we had an outbreak here in 2019. If you'll remember, they say that if that happens again with something else on top of COVID-19, that could be very, very bad for our healthcare system this year. Lauren Marshall with Parkside Pediatrics in Simpsonville says their offices have seen a drop in well child visits since the pandemic began.
If we're having a decrease in those well checks, then we're automatically having a decrease in the number of vaccines that we're administering.
The CDC says that countrywide, the amount of routine vaccinations given to both infant children and those aged 2 to 18 has dropped significantly since the pandemic began, something Marshall says is dangerous.
We don't want to leave our young kids, even our older kids, our adolescents, unprotected. Schools are kind of under a microscope when it comes to the vaccines that kids have to have.
In addition, DHEC adds that compared to this time last year, less doses have been given in the Palmetto State. The most recent data from April shows a 35% reduction.
We definitely do not want a large cohort of children unvaccinated throughout the state of South Carolina. That's just inviting another tragedy, unfortunately.
Dr. Joshua Brownlee is a child infectious disease expert with Prisma Health.
Most of the vaccines that we give in that first year of life are to protect against really dangerous diseases that present in the first year of life.
In particular, diseases like flu, whooping cough, and measles, which just saw an outbreak in 2019, can surface.
Measles is one of those diseases that even when you have a large population who's vaccinated, you can still see some breakthrough.
We prefer to have one pandemic at a time.
That's why offices like Parkside are stepping up.
We are taking lots of measures to try to help parents feel comfortable. We're keeping all sick appointments elsewhere.
Additionally, Marshall says they are constantly calling families to remind them. At the end of the day, though, she and Brownlee agree it's on you. And here at Parkside, they say they expect to start vaccinating for flu in early to mid-September. And something not a lot of people are talking about is the fact that this presumptive second wave of COVID, medical officials warn us could be coming, could also coincide directly with flu season, and the symptoms of those diseases are very, very similar. So they say that makes the flu vaccine, the one that we do have this year, more important than ever. In Simpsonville, Matt Koufax, Fox Carolina, the 10 o'clock news.